So, good morning, everyone. Good afternoon, good evening, whatever time that you will be viewing this presentation. My name is Michelle Jamator, and over this past few months, I have been part of the ALS Professional Foundations program. In phase two of the program, we were put in teams, and each team was to come up with a grand solution by choosing a grand challenge that is affecting Africa, and through the challenge I was part of a team, Tech Titans, so we were able to brainstorm, research, gather data, analyze the data, and come up with a solution that would um, benefit the African ecosystem. Part of my team members were Kelvin Mwendwa, who served as a project manager, Nancy Tiema, who was our UX researcher, Brian Mwangi, who was the UI UX designer, and Viola Adhiambo, who was the data analyst. I was able to stand in as part of the product manager. And so, welcome. A problem statement was healthcare. Healthcare is a global concern across Africa, and a majority of rural communities continue to face significant barriers to adequate healthcare access. Many families rely on myths and traditional practices that, while deeply rooted in culture, often misguide health-seeking behavior and delay proper treatment. As a result, preventable illnesses escalate, life-saving interventions come too late, and communities remain vulnerable to avoidable health risk. This significant disadvantages them and results in them seeking alternatives that are at times dangerous and not fit for their well-being. And so we meet Rose. Rose is a mother of two that lives in Meru, and her youngest child contracted tuberculosis. During Due to poor access to healthcare information, she and her husband mistook it for common cold and did not take the necessary precautions. As a result, the symptoms persisted for a couple of weeks, and as the rapid weight loss and intense coughs became more apparent, they were finally convinced to visit a healthcare facility and have him checked. This came with the need to further dig into their pockets for treatment and traveling costs, as the nearest clinic is miles away. Looking at some statistics of the healthcare facility availability across Kenyan rural counties, we are able to observe counties like Mandera, Wajir, West Pokot, and Marsabit, which have a significantly low distribution of healthcare facilities per 100 people. This is quite low and does not meet the World Health Organization requirements for healthcare facilities across regions. This, among other challenges, makes the situation at hand even worse. Other than the fact that these healthcare facilities are quite sparse, they are frequently understaffed and under-equipped, and the lack of reliable data for accurate health planning is a challenge. When we look at healthcare planning, county governments are also affected because with the little healthcare facilities that have been provided, it is also difficult for them to conduct accurate planning for healthcare facilities because the information is also not readily available as of the moment. Going further, we are able to look at the causes of preventable deaths in Kenya, in rural Kenya particularly, and delayed treatment stands at the highest. And looking at Rose's story, her son would have received earlier treatment were it not for the clinic being further away, and community health volunteers are also unable to penetrate easily into the communities in case of an emergency. The previous two graphs um, just showed a brief snippet of the reality of healthcare status across rural Kenya. This results in a lack of emergency response due to poor health facility distribution. These challenges continually contribute to high mortality rates, that are driven by slow emergency response, limited access to reliable information, and gaps in community level support. Imagine communities protected from the risks. If Ross had had early access to trusted information about tuberculosis symptoms, her story might have changed. This vision of a healthier and informed community is what drove us to develop our solution, and we believe this can be tackled by providing residents with timely information and a fast and reliable connection to nearby community health volunteers. And so we present to you AfyaApp, which is a mobile application that is capable of providing relevant and up-to-date health information on the go. It is tailored to function online and directly tackles the access to information and services problem. What are some of the key features that we have? Number one, offline data entry and auto syncing. When you look at the rural Kenyan landscape, we still have significant issues in internet access. And so it would be fit for our solution to be able to work offline, allowing the user, whether it is the community health volunteer or the patient, to key in their data, and later on when they are able to access information, the data will be synced to the server and the information will be consistent in the database. Another key feature is patient records management. We had initially stated that there is still a significant gap with regards to access to information regarding the healthcare ecosystem in the rural Kenyans. And so patient records will allow the user to keep track of their health information from their perspective, allowing the user to be engaged in bridging the gap by keying in their information and being able to record their progress. So, for example, looking at Rose's son, the mother can wake up and realize that the son had a mild cough today. She would key it in. If later on the fever drops, she would write that the fever dropped and also include home remedies that she used to alleviate the situation. Next time, when she needs the information, it can be easy for her to access it since this information will be accessible on her phone. Whenever the community health volunteer may be far away and she may not be able to access them, she can be able to empower her community by helping another individual who may go through tuberculosis. Health tips and resources is another key feature that Afya app offers. It provides an abundance of information and resources, all tailored to the user's demographic and accessible in their native language. I think you can attest with me that there are times when you're at home and you may cut yourself or have a minor burn or an injury and you may not know what to do in terms of first aid. And so Afya app offers health tips at the tap of a button where you can search whatever remedy that you're looking for. And this information is not just random, it's accurate and reliable from trusted medical databases where we will be able to partner together with medical professionals that will be providing this information. And so I'll take you through the wireframes of the various screens that our app has. It's a simple app allowing the user to be able to interact with it quite easily. We begin with the onboarding page where the user will click, choose a language. So one of the key features that Afya app provides is the language selection. You can be able to tailor the app to the language of the user, whether it be Luo, West Pokot, Giriama, Bukusi, wherever you may be. Your user will be able to gain adequate access to information. Then you can choose your location so that we can be able to connect you with a community health volunteer whenever you are in need within your region. Then once you're done, you click next and you will be moving to our home dashboard where you can be able to access a variety of information such as quick actions. This is where you can be able to get emergency contacts. Then you can access your profile, your calendar, contact a CHV, contact the chatbot, and my records. So when you click on the health tips, you will go to an health tips page where you can be able to see the symptoms of various illnesses, and with that you can be able to know what to do. First aid walkthrough provides you with a guide on what to do in case of a minor emergency that requires home remedies. When you go back to the home dashboard, you click on patient records. You have access to the records of the patient, the appointments that they have, prescriptions that the user needs, conditions, and histories. Then you can be able to chat with Maisha, our chatbot that is tailored to provide accurate health information to the user. We also have My Calendar allows you to set up your appointments and reminders on when you need next to visit a health facility and a doctor. It also allows the user to make prior arrangements in terms of transport and finances before there is an emergency. And so we are able to alleviate the issue of delayed treatment with the user being able to priorly plan themselves accordingly to visit a CHV. We conducted research across 20 individuals that we were able to interview, and so that we could understand the needs of the user, their pain points, and what do our target audience need. Number one, users want a reliable and easily accessible solution to their problem. This is one of the positive sides that drove our development of this solution. The solution should be safe and trustworthy to ensure utmost user confidence. And this is addressed with access to reliable health information that is accredited by the top health facilities in the country. However, users also raised two key concerns: the accuracy of the health information that is provided in the app, and the security of their personal health data. These are critical concerns that we must address to build trust. Based on our valuable feedback, we've been able to make two pledges. Number one, data safety. We commit to using all available techniques to ensure that any data that passes through our hands is kept absolutely safe and secure. And we have pledged to ensure professional inclusion. We include professional healthcare workers alongside our community health volunteers to ensure that the information provided is accurate and from trusted sources. And so the user will be able to get access to reliable information and not just information that does not align with the health standards. There are several applications already that are providing similar features, and these are MyDawa, a pharmacy application that provides doctor access, Zuri Health, telemedicine and medication delivery. We have the Kenyatta University Teaching and Referral Research Hospital that um, is utilizing such applications. We have apps like Bion 8 that offer online consultations, AfyaMoja, which helps find and book local providers, and Casualty provides offline emergency first aid information. So, what is the niche that our application provides? By contrast, AfyaApp is tailored, lightweight, and community-focused. By optimizing specifically for CHPs in the last mile settings, you could deliver a more user-friendly, efficient, and locally relevant tool that can potentially scale with strong impact. The projected impact of our solution: we are aiming to reduce time on record keeping for healthcare volunteers, improve care for rural families by providing timely information, empower CHVs with better tools, and most importantly, ensure that disadvantaged families are reached with essential health services. So, what's next? Should we acquire the necessary funding and support? Our next steps are clear. We want to hire a dedicated team of developers who will build the solution from ground all the way up. And we want to conduct more user research to identify extra features and unmet needs as the final product that can satisfy. Our goal and our desire is to satisfy the user, to alleviate the healthcare status in rural Kenya, and provide a tailored solution that meets the needs of our users. This brings us to our call to action. We invite you to support or partner with us, the Afya app. Our final thoughts are that every community deserves access to healthcare information and resources. AfyaApp is a solution that brings these vital resources within reach, and we believe that with your help, our application can end up saving thousands of lives and improving health and well being of millions. Let's do this together. Thank you, and looking forward to seeing AfyaApp out there saving lives.